Good afternoon, everyone. My name is Megan Wolf. I am with Trust for America's Health, and along with my colleague, Dr. Cron Phillips, we lead TIFA's age-friendly public health systems movement. It's a movement now, and not just an initiative. We're so glad that you have joined us here this afternoon for our monthly training series. This year, we're focused on our 6 C's framework, and each month we will be providing some information about each of the 6 C's, and we've invited some of our good friends and new friends from across the country to provide examples of the 6 C's in action and how public health is operationalizing each of these 6 C's. So Karan, let's move forward on the slides, please. So Trust for America's Health is a nonpartisan, nonprofit public health research, policy, and advocacy organization. We're based in Washington, D.C., and we have as our mission to advance evidence-based policy and advocacy with an equity focus. Our vision is that the United States would be a place where disease prevention is a national priority and where healthy aging is a core function. Next slide, please. So for this series, for today's presentation, we would ask that everyone please keep your devices on mute during the presentations. We will have an opportunity to interact with our speakers today after their formal kind of presentations and slides. But if you have questions in the meantime, please submit them in the chat. We will capture them, and hopefully we will have time to get to all of your questions and have some great conversation this afternoon. So I think I can introduce our speakers at this point. I'm really happy to have with us today Bill Armbruster. Bill is a senior advisor for AARP Livable Communities and a program manager for AARP Network of Age-Friendly States and Communities. And I think of Bill as the all-around guru of age-friendly communities across the country. So whenever we want to know anything about where age-friendly communities is and the progress in any of the states, and finding great people like our new friends here at Greendale Health from Wisconsin, we reach out to Bill. So he's wonderful. And then we also have with us this afternoon Megan Mermel and Ashley Haas from Greendale Health Department, and we're really excited to have both of you here today and to provide even a little bit more in-depth examples of how public health can help to create age-friendly spaces in partnership and by connecting and convening kind of our multi-sector partners. So I'm going to turn this over now to Bill. We'll start with you and take it away. We're so happy to have you here this afternoon.
Great, thanks, Megan. Pleasure to be here. Connecting and convening, I think that says it all, whether you're looking at age-friendly public health, age-friendly communities, age-friendly health systems. This is where it's at. We really can't do this work alone. And as we think about this work, it really is who else is, and I think one of the issues is we tend to go to our traditional partners, the people that are always in the same room for us. And I think in order to really be successful, it's really about thinking outside of that and bringing in non-traditional partners. And I want to go through a little bit of that today. But I do have a question for folks. I see a couple familiar faces in the folks that are here in attendance, but I'd be interested to see how many people here are in a community that's enrolled in the age-friendly network, and then also if you are connected on that work in your community as well, just so I get a little bit of level setting on that. So we can go to the next slide. I mean, it's like speaking to the choir on this next slide, but America's aging. I love this graphic though, because we just had to update it from the 2010 to 2020. I think this really, no matter who you're talking to, sets a tone about how quickly our communities are aging in terms of the population 65 plus as that grows. And also, if you haven't done it, I would suggest there's all new population pyramids that are available now. And you can see that your pyramid is no longer a pyramid, but sort of like a boa constrictor that just had a meal or some other column type of thing. But I think it's important to have this conversation visually with people as well, just to let them know, we're not just jumping into what people were referring to as that really ominous silver tsunami, but I think how do we, have this conversation? How do we embrace this dialogue in like a really positive way? So if we can go to the next slide. One of the things we know over and over, people want to stay in their in their homes. That's been, constant for decades. But we're seeing more and more people just don't want to stay in their homes. They want to stay in their communities, and they want their communities to be ready for them. We used to talk about aging in place, and all I could ever imagine was somebody sitting in a chair in their home and people just bringing in resources. Look at, you can age in place, you can age in place. But I think we really need to think about, redefining place as to include community, and how that really does connect people not only to their health, but to access to services. And again, people want to live in what we call forever homes. I always joke I live in a Peter Pan home, because my home is designed for people who will never grow old. My house was built over 90 years ago. The laundry's in the basement. The bathrooms are a little wider than my shoulders, and the bedrooms are upstairs. So at a certain point, my home is going to make a decision for me. So are we having those broader conversations, from a public health perspective? Are you talking about how we're building the future of our built environment and the future of our communities, so people can have those decisions? And even in this economy, if I were to sell my now 90-plus-year-old home, I could get something smaller, but it would cost, and newer, but it would cost more than my home is. So I don't want to be at my age and taking on a mortgage and thinking about this. So thinking about also non-traditional conversations that you can get involved with. Next slide. So one of the things that we saw as an organization is that people were talking about youth and family. And anytime people were talking about older adults, it was frail older adults, it was institutional care, it was really very ageist. And that's sort of why ARP got in to become the US affiliate of the Global Network on Age-Friendly Cities and Communities, to say we need to think about communities and community health across all life segments, and not just have an adult be anyone from 18 to 118, but to realize there's things we should do. So as part of that, we created the ARP network of age-friendly communities. And then in 2017, we expanded that to states. So as of today, we have 745 communities enrolled in the network, 9 states and 1 territory, and about another dozen states that are exploring enrolling in the network as well. And the thing we like about this, it's not just hey, let's do this. You have to get buy-in from your elected officials. We don't care who the convener is. The convener can be local government, it can be an institution of higher learning, it can be a coalition, it could be volunteers. But in order to enroll, you have to have an elected official, elected body say, yes, we support this, because there may be decisions that need to be made about us as a community from that level, as well as looking at other aspects. So we go to the next slide. So as we think about this, age-friendly, when it was being developed across the globe, it didn't matter where you lived, what level your income. These are 8 things, which now became the 8 domains of livability, that we need to look at and address the quality of these features in our community, looking at the built environment, from housing and outdoor spaces and transportation, and then the social and services, from civic participation, employment, communication, information, respect, social service, social participation, and health services and community support. We need to have all of these things in place in order for people to successfully age in their community and to be included in that. So part of that was really including the voice of people of all ages, particularly older adults, as communities are planning. If we can go to the next slide. So as part of that, there's a process that every community goes through. It's a 5-year plus process, you know, a community enrolls, which I just talked about, elected body. There's a convener of this. They spend the first year listening. What is it that people want? Doing listening sessions, doing focus groups, doing community surveys. And from there, plus doing an asset inventory of what's already going on in community. And then they develop and submit an action plan and say, yes, this is what we're going to do over the next 3 years. And as part of that, figuring out how they're going to evaluate that. This is what we want to do, how we're going to do it, who's going to lead each aspect of it. We don't look for this to be just a municipal-led action plan. Hopefully there's community-based services and supports in there. There's you know, other groups in there. There's volunteer groups, there's you know, hospitals, there's health systems, there's you know, a variety of key stakeholders who come together to say, yes, this is the piece we can help bring together to look at our plan. Then they implement it. And then assess an impact and put a progress report. But one of the things that's really important throughout is the voice of older adults throughout. From the beginning, is this something that we need? Are you listening to folks as you're doing your surveys? Are you thinking and engaging older adults as you're developing your plan to make sure you're not just creating what you think they want and what you think they need? So how do we go about and do that? So that's the age-friendly process. Next slide, please. And then you can see there's, you know, communities across the country, and this was just updated. But again, you see more communities where there's more populous areas, more populated areas, or where we've had states or communities who've taken this on to say, yeah, this is something we think is a great strategy for us to be convening and connecting with folks moving forward. Next slide, please. And again, what are some of the benefits? You know, it's a structure. A lot of times communities aren't sure where to start, or they have pieces of it. We're doing this, somebody else is doing that. How can we sort of come together? How can it bring and foster partnerships together? I remember working with one community. It was a large, more of an urban core, and they wanted to bring folks together from all the domains to create work groups and to have this initial discussion. And they had over 40 people from transportation there. The majority of them never met before. And the synergy of what came out of that, they were working on grants together. They started working on mobility management, you know, as that was starting to come forward. So those partnerships, they were able to get funding. You know, that I think is one of the powers here is really bringing together people to see how they can connect and see how they can support each other. And again, enables change that benefit people of all ages. You know, if you're looking at complete streets, if you're looking at walkability, if you're looking at safety, you know, those are the types of things that benefit everybody. And it provides resources to really make sure that people in your community feel like they're being heard, instead of, hey, look at the great plan we did for you. You know, it's we took the time to talk and engage. And as part of that, we provide technical assistance, you know, access to other communities across the nation, materials, and again, help and resources to help folks move forward throughout the process. Next slide. So what are we learning? I think this is sort of the important thing. Every year we do an annual survey of leadership. We go out to those communities that are enrolled in the network, and we ask them. This year was a really lengthy, almost 2-hour survey. That this year we promised it will be less than 20 minutes. But we do a lot of listening ourselves. Who's leading the work? Where's it coming from? So we're seeing municipal governments as the #1 area, 54%. We're seeing age-friendly teams, task force coalitions coming in second. Aging service providers, above and beyond, you know, area agencies on aging. Volunteers, bringing community volunteers and residents together have been another area, local nonprofits. And now what we're seeing trending more so, and we'll see these numbers jump for next year, higher education. We're seeing colleges come in, not just colleges that are part of age-friendly universities, but colleges that see a reason to come together. So we have, you know, Rutgers University, we have UMass Boston, we have UMaine, we've got we've got Dr. Kathy Black here from down in Florida. We've got University of Arizona, Montana, University of Illinois, the Ohio State University. The list goes on, where we're starting to see these universities come together to say, hey, we've got resources too. And we can help analyze data, and we can access interns and students and really figure out a variety of ways to do things. And then also healthcare. That again is if you had asked me 4 years ago where higher education and healthcare was, I'm like, yeah, it's not really on the radar, but we're starting to see that grow as well. Next slide, please. So then also, do we not want to know just who's leading it, but who's there? Because we know this just doesn't happen in a vacuum. So again, we see no matter who's leading it, municipal governments are a key part of that work. Aging services, age-friendly coalitions, not-for-profit. But here's where you're seeing healthcare jump up to 35%, chambers of commerce and business organizations, 29%, higher ed, 22%, regional planning organizations are huge rise, where they're coming in and say, hey, we're convening 9-10 counties. We want to come in and convene them through the age-friendly process. So as they're thinking about this, so we also see a culture change in the conversations going on, that people are aware of age-friendly, they're aware of the domains, they're aware of this process as we get more and more communities involved. Next slide, please. So we wanted to learn a little bit more. So, again, 5-7 years ago, if you had asked me which municipal departments were leading this work, it would have been aging services, it would have been aging services, and it would have been aging services. Now we're seeing Parks and Rec coming in, community and economic development, planning and zoning, aging and disability. So just in the last couple of years, we've seen this huge jump. And even though it's listed in red there, 10%, we're seeing that public health is starting to get more and more involved with age-friendly. And I think this has always been an interesting conversation with me when I'm working with a community and they're like, well, who do we approach? How do we approach them? Particularly when it came to health departments, public health, and that was always sort of a challenge. And then we started to, see some of the great work going on in Florida with public health, becoming actually a convener of age-friendly, and they're seeing where the synergies can come together, and people are starting to think outside of their silos. And we also see, so we have 8 states that have health departments and public health leading some of their age-friendly initiatives. And as I mentioned, we also have age-friendly states. 6 of those states are either led by or have a strong public health focus. So we're seeing this conversation, not just what's happening at the neighborhood and community level, but we're having this conversation led from the top down as well, and figuring out how to meet in the middle. So I think that's promising as we're seeing that type of expansion, extension. Next slide. So the other thing which I think is interesting for this conversation, when I was going through the age-friendly process, I was talking about each community has to create an action plan. So what we do is we have 272 unique action plans, because we also have communities who work together. They're like, yeah, we don't have a lot of capacity, or we normally work together, so we let them come in as a region. So we have 272 action plans that cover like 342 communities, but we also read and look at all of these and we code them. And we ask, like, what are they doing in each of the different domains? So I pulled out a couple of things here to show 90% of all the communities in the network that have done an action plan have focused work in health and community services. So they want to do this work. Their interest is there. We're also seeing 61% of those communities are doing things to improve health and public health outcomes. That's huge. So there already is the synergy. They're trying to figure out how to do it, whether you all are at the table or not. There is interest in how do we do that. So how could that actually help better support your work? And then again, we see over half of the communities are developing mechanisms to increase access to healthcare. that I think is another big issue that communities are hearing from their surveys and their assessments, that this is what people need. And then that does break down into whether it's telemedicine, whether it's transportation, whether it's, information to help people better understand, how to access the healthcare system and whatever it may be within their community. But then also looking at, we're seeing the social determinants of health come up more as sort of like a co-organizing, that people aren't just thinking about, all right, we're going to look at the 8 domains, but they're saying, hey, we really want to look at this as part of the social determinants of health. And how is it that what we're doing can help have this broader community impact? So there is a lot of great work. But again, communities reach out to the people they know, they organize with connections and who that they're able to connect with. So the more that we can help with these linkages, the more I think it helps with things like the public health outcomes, with having health at the the other community tables. I remember working on complete streets legislation before it was cool, about 10, 11 years ago. And some of the partners that came out were the health department, were American Cancer Society, were some of these folks who you think are very sort of like, they're focused with their chronic disease, they're focused with this, but they were like, yeah, if people can't walk, if they can't have access to the places they need to go, if they're not having that connectivity, that's going to negatively improve their health as well. So again, to me, this really does provide a really great opportunity. If you're not sure your communities connect in the network, or if you are interested, you can send me an email. We can help with guidance. We can help with connections here. Next slide. And then again, there are what we call the age-friendly brands, or part of the age-friendly ecosystem. So, we're seeing this come forward, that, about 20% of the communities in the network are connected with an official age-friendly university, an age-friendly healthcare system, age-friendly public health, as well as inclusion of dementia-friendly as well. So I think the interest is there. It's about, having conversations and how can we bridge them even a little bit better. Next slide. And just lastly, here's some resources that you can go, if you're not getting it, we have a nationally award-winning newsletter that comes out weekly, but it's like a cross between a journal and highlights of what's going on across a variety of topics of livability. You can also go search our interactive livable communities map for either age-friendly communities or folks who are recipients of our community challenge grant, which just closed last night. So a lot of things, as well as free publications that anyone can order, download, anything at no cost. So I will stop there, Megan.
Thank you so much, Bill. Such great information. We love seeing all the connections, all the connecting and convening that's happening with public health and in partnership with age-friendly communities. And I highly commend the Livable Communities landing page. You can actually go on and find out how livable your own community is. I found out that mine is not as livable as it should be. So really, really great information. Thank you so much, Bill. Okay, let's advance the slide, and then we will turn to Ashley and Megan from the Greendale Health Department in Greendale, Wisconsin. Ladies, thank you so much.
Thank you, Megan, and thank you, Karen, for asking us to be here today. We're very excited to share our Fostering Healthy Aging presentation. Bill really kind of set the stage for us to talk about our work group and our project. So next slide, please. Just a little bit more about our community. We live in the village of Greendale, Wisconsin. It's part of the Metro Milwaukee area. Our population is approximately 15,000 residents. Greendale is a National Historic Landmark and was named such in 2012. It is also one of 3 Greenbelt communities, planned community from the 1930s. Greendale has a higher population of older adult residents than the county or the state of Wisconsin. 23% of our residents are older adults. So next slide, please. We're going to talk about our Successful Aging in Greendale CHIP group. Before I get into that, for those of you who are not familiar, Wisconsin state statutes require local health departments to establish and implement health plans to address the health conditions affecting their communities. So our CHA is our community health assessment, and our CHIP is our community health improvement process, also known as community health improvement plan. Every 5 years, the Greendale Health Department performs this community health assessment, and after the data is collected and analyzed, we identify our trends and emerging needs and report out the findings to our community. Back in 2016, our community survey results identified successful aging as one of our top 3 priorities identified by our residents, and that would kind of be a priority area that we would be addressing over the next 5 years. So the SAGE Successful Aging in Greendale for Everyone work group was formed. It was originally made up of residents, members of community nonprofits, representatives from the Board of Health and Health Department staff, as well as some local businesses. Next slide, please. Just wanted to highlight the vision and mission of SAGE, and then the 2 pictures here are kind of how the group evolved in different spaces, different years since they've been formed. Greendale will be an age-friendly community where everyone can age successfully is their vision, and mission is SAGE will support innovative, sorry, I have my slides of everyone's faces right in front of the slide. SAGE will support innovative ideas to promote healthy and productive lives for Greendale residents, especially older adults. Next slide, please. All right, so early in the process of SAGE, they recognized the importance of obtaining more information, more than what they were able to glean from the community health assessment on the needs of older adults. The SAGE committee believed that community input was critical element for their initiative to be successful. So they developed strategies to include the voices of residents living in their own homes, as well as individuals living in rental units, including subsidized housing. Some of these strategies that they employed were offering free transportation or a free meal to get these residents to participate in their listening sessions. The information that they obtained was extremely valuable because it really validated the importance of including the voices of older adults when making recommendations regarding successful aging in our community. So a total of 5 listening sessions were held beginning in 2017 to hear from community members about what they believed were the major strengths and concerns that should be addressed. After collecting this data, the members of SAGE discovered the AARP Livable Communities website. They made the decision to adopt the AARP Livable Communities framework, and they began to develop an action plan that would run from 2017 to 2022. And then this photo right here is some of the women in SAGE making a presentation to the village trustees to announce their acceptance into the AARP Livable Communities initiative. Sorry, I lost my train of thought here. And then partnerships. Early on, they realized that partnerships were really the bedrock of and key to their success. They've partnered with so many groups in the community and continue to look for new partnerships. Next slide, please. And then Ashley, I will turn it over to you.
All right, great. Thank you. So moving forward, our group was very active. They had big dreams. They wanted to take on every single domain, but they decided to focus and start in domain 1, outdoor spaces and building. So Greendale, when it started in 1938, the concept was really to build a community that felt like its own little community outside of the city. We are maybe 10, 12 miles outside of Milwaukee. And this was a new thing that happened in 1938, where they're trying to expand into farm areas. Since the incorporation, to this date, 85 years later, we still have residents who very much value our parks and our recreation, as well as our walking paths. That's something that Greendale really prides itself in. In 2022, just recently, we had a village survey that went out to all village residents in the mail, and people could also answer that survey online. And just some unique things that carry over 85 years later is that 77% of those that took the survey, they value very much the parks and trails, and 60% of the participants use the paths very often. So we know that people are out there, but what we didn't know at the time when we set upon this community challenge was, what's the condition of our walking paths? Are they accessible for everyone, whether they're 5, 55, or 105? We do have a few residents who have tipped over 100 years old. So this is something that's very important to our community. Initially, they set out on doing this walking audit, and it started with just our successful aging group. They knew they couldn't do it by themselves. So how do we get different groups of people from the community that would have an interest and input into taking a look at our walking paths, walking all throughout our community, and really analyzing whether it is considered walkable, if there's anything that we're not seeing that maybe somebody else is seeing. So our group, next slide, please. Our group decided that they wanted to get a lot of partners involved. Greendale is a small, tight-knit community. Sometimes it's referred to as the bubble. You know, we have all of these things which give us a good foundation for putting together something like this. Now is just identifying those key groups. We had the Girl Scouts, we linked in AARP, we linked in our Greendale Women's Club, and our seniors that we were already working with to set out on this walking audit. So they walked all of our paths, and in the process, looked at things, what would they like to see? They followed the toolkit. This went on for a while. As we know, a challenge can be getting all of those groups together and getting everybody on the same page, because what might be a priority for one group may not be a priority for another group. So really, what is our collective goal? Bringing it back to that, we want everybody in our community to be able to age successfully throughout the lifespan. An important aspect of that was, at the time, our village president, he was, I guess, considered a senior. He had older adults for parents. He wanted to keep his parents in their homes in Greendale for as long as possible because they were considered one of the originals. They had been here in Greendale since the inception of it. And so Bill had mentioned, you know, it's really important to get your elected officials involved. And that was the link, the puzzle piece that we were missing, is that we really needed to get the buy-in from our village leaders, because he had that personal tie to wanting to make Greendale a more livable community. we were able to overcome that barrier, that challenge a little easier. And then now that it's been 5 years since we started that, our village leadership is still very much involved and proud of what Sage is doing, because it just took that exposure. And I will never underestimate the importance of getting your elected officials involved, because sometimes you may hit those challenges, which if we go to the next slide, I can talk a little bit more about. So they completed their walking audit. This is the Girl Scouts and some of our health department staff taking a look at our walking paths. They mapped it out on our map of Greendale. They measured certain distances and marked areas that were a cause for concern. We had to kind of think in almost like how can I show this as a mutually beneficial thing for the village as a municipal structure and our residents? Well, our comprehensive plan for our village already had a number of goals that were related to keeping up the beauty of our walking paths, holding on to that history. There was a lot that referred to our outdoor spaces and making sure that it was accessible, but we needed to expand on that. So we were able to draw on that and point that out to our elected officials like, hey, you already have this in your comprehensive plan. We want to do the work. You know, how can we support you in seeing out your comprehensive plan for our community while in turn making it better and improving it for our residents? They decided on what can they do in our capacity with the help that we have. We do have 2 other challenges that I would bring up is we are connected to a county trail. So we have an oak leaf trail, and that's county owned. And then we also have a lake. It's kind of like a pond, but it's called Scout Lake, and it has beautiful walking paths all around it and throughout the woods there. But that property is also county owned. So they did identify places in those 2 areas that they would love to improve upon, but working with the county was a bit more difficult. So for the group to stay passionate and engaged and really push through to see this project from beginning to end, we needed to find something that was actionable, that we could successfully implement, and then be able to evaluate without having to rely on the county for any of those things. I'm sure one day we'll get the county to hop on board, but for what we could do for our village walking paths was they noted after the walking audit that several of our older participants felt that they needed somewhere to rest. These paths loop everywhere. They loop between our houses, and that was the point of why it was designed that way. Our architects and engineers back in 1938, they wanted to create this pedestrian path network. So really, they're all interweaving between houses, behind houses. You basically can get anywhere without having to go on a main road. They felt that because of it was laid out that way, that it would encourage people to meet each other on these pathways and then have to have those connections. It's told that they were purposely made skinny so that when you came upon somebody else on the path, that you'd have to step aside. And when you step aside, you'd have to say hello, and then you would build that community. So how can we keep that thought and that goal while also improving, because we know we might need a little bit more space. If there's a wheelchair, we need more than a tiny little area, but how can we still bring in community? So they went right ahead and they proposed benches and some signage. The signage was intended to help along the paths, because that's something else that they came up with, is that yes, these interweave throughout our whole entire community, but I don't know where to go when I get to this fork in the road. And that made some of our older adults hesitant to get started on a path because they were nervous that they were going to get somewhere, not be able to rest, and then not know where to go, and they'd be stuck in the middle. Greendale actually has, I think, Megan, correct me if I'm wrong, is it over 50 miles of paths? Yeah, so we
I
have
believe
over
it's
50 miles
52.
of pathways, and we're a pretty small community. I don't know what our total square mileage is. So 52 miles. Yes, we have 52 miles of paths in our community. That's a lot of paths to take a look at. Actually, today as we speak, it is raining out, but before the rain started, we did have some groups that were out checking on our paths again and doing a mini walk audit for us. Next slide. And this is an exciting slide because you can see in the bottom left the wayfaring signs that were added. So the groups that assisted with this process, they're listed. They have their logos on the bottom. Our DPW, our Department of Public Works, came out and helped the Girl Scouts install these signs. And then there was a big celebration at the benches, and you can see right above, our Department of Public Works worked with us to put in concrete slabs, order the benches, and then install them. And then they each have a plaque on them that's representing that it was part of this community challenge initiative there. And then they took it one step further because as they were going through and marking up their paths, they felt that our walking map needed to be improved. We used to, and I'll show here, we used to have a walking map that was, you know, just a path, and there was just like 3 or 4 paths highlighted on there. They wanted to improve it. They added more paths, and it looks now more like the picture there. And we still hand these out to this day. So we actually have to reorder these all the time. Our group made it, that was 2019. We just put in another order to get these printed again. We have a welcome center in our downtown area, which is tiny, but it is frequently visited, and they're always calling us for more walking maps. So it's a really successful thing, and it brought engagement. It brought people together and brought value to a place and a space that maybe wouldn't have gotten that attention before. You know, everybody was starting in 2019, everybody's starting to, you know, go inward. We're going digital. People seemed to form less connections, and then COVID hit. And what better time to have a brand new walking map than when you are quarantined at home, or we are all told to not go out. A lot of residents felt that walking had helped during that time period. They were able to get out and walk. People are always out there walking their dog, just walking around. It's so important in so many ways, and it can affect so many different parts of a person's health and their life quality. It just was a really successful and heartwarming project that our group took on. All right, and then I think next we have Megan, who's going to kind of bring us back together with what else we've done.
We just wanted to highlight a few more of the notable accomplishments from SAGE. We did recently complete our first 5-year cycle as a livable community. We're part of Dementia Friendly America Network. We have an established Greendale Memory Cafe for people with dementia and their caregivers. Anyone from residing communities are also invited to attend that as well. We last July organized an older adult health screening and resource fair with over 90 participants. No one was allowed to sell anything. It was a very health screening focused, engagement focused resource fair. We've published many articles in our village newsletter on scams and transportation options. And we've also created a dementia newsletter that is currently under construction, but it was published for several years, and I believe there were like 60 residents who subscribed. We've offered numerous education presentations at our Greendale Senior Social Club, local senior living facilities, and held small group health education trainings. Currently, our nurse does 3 blood pressure clinics a month at local community sites that are very accessible to older adults. And we have hosted some intergenerational bonding events and workshops. Next slide. So looking ahead for SAGE, just a quick couple of things. We're always looking for new partnerships and exploring. Sometimes there's new businesses that come to Greendale, new organizations. Most recently, we are exploring a partnership with our Greendale Children's Garden to incorporate some more intergenerational programming into their current offerings. Data collection can sometimes be a challenge for us since we're looking for zip code specific data, and we are such a small community. A lot is available on a county level. So we really have to lean into those community connections and conversations. And then as Ashley mentioned, we are starting to conduct some more walking audits, as it was, I believe, 6 years ago that we did the initial one. So we want to see if we can do any other improvements that way. SAGE is assessing our capacity currently. I'm sure others have felt it. It's kind of like the great reset after COVID, and everyone's getting back to everything and wanting to get out there and do more programs and have more engagement. So our goal and best practice is to engage all sectors of our community, or at least make an attempt to do our best job there and get a diverse group of individuals involved. Many of our current and previous members have gotten older, and some of them have aged out, so it would be really great, but is also a challenge to get some younger members engaged, which we do find challenging just because of competing priorities, younger families, and unfortunately getting individuals to realize the value and appreciate the work that we do, because eventually they will be older, and just getting them on board a little bit sooner, but that forward thinking can be challenging. And then equity is one of our health department's values, as well as one of our more recently overarching identified strategic priorities. In February, we held a CHIP summit, so that ties back that community health improvement plan or process with all of the members and volunteers from our CHIP groups. We wanted to provide them with equity training and some exercises, just so we could get them really looking through that lens, getting them into some of those like maybe uncomfortable conversations, but trying to find that common ground or agreeing to disagree, just so we can build our capacity in our community to consider looking through that equity lens as much as possible. And then I believe next slide, and that is all from us.
Great. Well, thank you, Megan and Ashley. A terrific presentation. Such exciting work. I know Bill put in the chat that he wants to visit. I think I want to move to Greendale. It seems like a wonderful community. Just the commitment of everyone there to make it livable for all ages. So, Karan, why don't we pull the slides down so we can see each other, and we will open up our session now for questions, for answers, questions, discussion. So I have several questions. So I'm gonna start. I'm gonna lead with questions, if that's okay, and then we'll open it up to others. But so Bill, this is for you, and I know that in some states, some communities, they have kind of shifted those 8 domains. So they've, some states have added another domain, or I wonder if you could speak to that a little bit. It's like, are the 8 domains the only thing that, that is that the only list? Is it finite, or is there a little bit of flexibility?
this is a framework. It's all about guidance. It's all about making sure, what works for your communities. So we do have, particularly over the last couple of years, we've had folks create an informal disaster preparedness and emergency response domain to say this is huge for us. We've had other communities pull in elder abuse because they need fraud and elder abuse they wanted to pull out. And during COVID, we saw two things that are embedded in the domains, but we saw food insecurity and social isolation that folks said, we understand it's there, but we need to call it out completely. And then we've had a couple of communities who've actually overlaid research. They've sort of connected with their local higher education institutions. And they said, we really want to show impact. We want to show what it is that we're doing. So that's that. But we've also had communities who've condensed to say, you know what, respect and social inclusion, we're going to make sure that that's cross-cutting to everything. We're not going to pull it out separate. We're going to have it as a checkbox for every conversation that we're having. We're going to take communication and we're going to put that as a checkbox to everything that we're doing. So again, we do look to have those included. And we've had some communities that are, smaller capacity, or even some communities that have larger capacity said, we're going to focus on these three things. These are, from what our survey said, housing, transportation, and and communication or health, are our top issues. This is what we see far above and beyond everything else. We're going to focus here, and then we're going to add things on as necessary. We can't wait on these, and we have to figure out where to focus. So yeah, that is completely a possibility.
Great, thank you. Karan, I'll turn it over to you to facilitate further conversation.
Thank you, Megan. Are there any more questions? I mean, again, everyone is thoroughly sending their just congratulations and positive thoughts about how great this information was. I do see a question from Lindsay. How would you differentiate between age-friendly communities and age-friendly public health systems? That is an excellent question. That actually might be for us here on TIFA too. So Bill, and then maybe
I'll
Megan.
let you start and then I'll fill in.
Well, Megan, we'll turn it back over to you, and then we'll let Bill finish the question.
Sure. Yeah, it's an interesting question. So yeah, there are different components to what we often think of as kind of the age-friendly ecosystem. And so age-friendly public health systems is really focused just on the state and local public health, governmental public health system to enhance their role in older adult health and well-being. Whereas, and that's it happens in a number of different ways. Some states are doing a lot of things on their own through multi-sector plans for aging or master plans for aging, like in California, where the Department of Health is really engaged in that. Whereas the age-friendly communities movement is really focused on that AARP focused 8 domains of livability and making a community livable. And I think what we've seen here today is the opportunity to align these two movements. So where we have state and local health departments like Greendale leading the designation or the work of becoming an age-friendly community, where age-friendly public health components can be part of that, like creating and leading the change of those systems, looking at those emergency systems and emergency plans to make sure that they incorporate older adults. That can be a component of both age-friendly public health and age-friendly communities. So that's how I would differentiate. Bill, I don't know if you have anything further.
I agree. And I think it is, better together is just sort of the simpler way to put that. Is we do see, like, not to pick, but on some of these, they're very insular. What happens within a health system walls, very much age-friendly health systems, at least when you read it, comes across as very much patient-centered care, which is great. But how do we take that? I remember being in a room about a decade ago, regional planning with health systems and home and community-based service providers. And you ever been in a room where everything's going too well? And everybody's talking about home and community-based services and just smiling. And then the person next to me says, how do you define home and community-based services? And the hospital said, home care, we've got it covered. And then you heard a gasp, an audible gasp across the room. 3 months later, we came up with sort of this common definition of what we could agree upon to be home and community-based service, because they thought about the service that they provided versus all the other supports and services across the community that could literally impact that and reduce readmissions and all the rest of the stuff. So I think it is, and that's sort of one of my missions along this way, is to break down those barriers. I mean, we're doing it at the community level. We're getting people to talk who wouldn't talk before. Let's also take, for the broader age-friendly ecosystem, let's have agencies see how we can work. You may still have things you want to do on lead levels or asthma or diabetes or access to public spaces, but if we can do that through walkability, through accessibility, through connection, through all these other things, fight isolation, the synergy, I think that's where you see, and we're constantly talking to communities. We have this thing called the circles of involvement, to help them organize and plan around who else could be in the room, who else could be at the table besides the 5 people you're used to sitting with. So yeah.
I think I'm going to go ahead and pose one more question. I know we're almost out of time, but any recommendations for recruiting and engaging non-traditional partners?
Yes.
I jumped in there in the chat too and gave my little peek of advice. So I'll let you take it over, Bill.
I used to, I work by starting age-friendly communities and now manage the network. So I get this from small communities all the way up. But I used to always host what I would call these make me or break me breakfasts. And it was all about gatekeepers. It was all about those people who were in those positions. They wouldn't necessarily be part of your core team, but those are the people who needed to hear this message early on. They needed to have this conversation on connection. Then they would either assign one of their staff. They would just say, let me know, I believe and I support in this. So it's going in with an agenda that gets you something that's not just coalition members sitting at the table, but gets that support. So when you are talking about these issues, maybe it is the local media that you get somebody who's going to do regular articles. Maybe it's a foundation. I remember keeping couple foundations at the table just initially for insight, and now they changed their framework of some of their funding to be not just vulnerable older adults, but an age-friendly community focusing on at-risk older adults. So having some of these strategic regular conversations and then thinking about how to communicate updates with them. So it's not just when you need something, it's like, oh, hey, so constantly celebrating and letting them know within the framework. It's within the framework of age-friendly, or not just we did this, we made this street better, but how does that impact the community? So taking that and then telling the broader impact story found to be very successful. And then you have people seeking you out. Mm-hmm. So you turn that culture, that conversation around.
I feel like you stole language from my mind. I use the word gatekeepers, and I often say, don't just talk to people when you need something. You have to just build relationships. Yeah. So I feel like Bill and I are developing a hive mind a little bit here. So with that, we want to thank everyone for attending and hope that you've gathered some new information. I'm going to go ahead and close this out. So if you are available next month on our third Thursday again at 3 p.m., our April training will focus on coordinating existing supports and services, and you can register for this on our website under events, and that will be, and also the recording of this training and the slides will also be shared as well. And then for anyone that is viewing this as a recording and not viewing this as a live training, please pause the video now so that you can record your viewing of this training by navigating to the website below. And we thank you all so much for joining us today.
And thank you to Bill, Ashley, and Megan so much for participating and for your time. We look forward to staying connected with you. Great. Thanks, everyone.
Thank you.